Throughout this clip, various visual conditions are discussed. First, a baby is shown with its mother.
Since visual problems may develop gradually over time or even change from one condition to another, it's helpful to learn about the different types of conditions that may affect your child. Here are a few of these conditions, along with simulations of how things might appear through the eyes of a child.
A young boy with albinism is shown. He is wearing glasses and sits on some steps leading up to a play structure on a playground.
Albinism is the hereditary condition producing a lack of pigment in the eyes, skin, and hair. The macula, the most detail-sensitive area of the retina, is underdeveloped, and so there is decreased central vision.
The word albinism is seen at the bottom of the screen using white lettering in a black box. The screen brightens to simulate vision in individuals with albinism.
Through the eyes of a child with albinism, the world can be painfully bright and glaring.
An African-American toddler boy is shown walking around a room filled with other children and play structures. The camera focuses on the boy's eyes.
Aniridia is the hereditary condition producing a total or partial absence of the iris. The iris is the eye's muscular mechanism for controlling incoming light.
The word aniridia is shown at the bottom of the screen. The screen brightens and then areas at the far left and right of the screen darken to simulate vision in individuals with aniridia.
Children with aniridia have decreased visual acuity and acute sensitivity to light. They may also have a loss to part of their field of vision corresponding to the area in the eye where the iris is absent. Vision fluctuates depending on lighting conditions and glare.
A blond toddler boy with thick glasses is shown.
A cataract is an opacity or cloudiness of the lens. This opacity restricts the passage of light.
The word cataract is seen at the bottom of the screen. The screen blurs, brightens, and colors diminish to simulate vision in individuals with cataracts.
The result of cataracts is a reduced visual acuity, blurred vision, poor color vision, and sensitivity to light. Visual ability fluctuates according to light.
A brown-haired toddler boy is sitting in the lap of an adult and looking at a book.
Glaucoma is an eye disease which causes increased pressure in the eye due to a blockage of fluid circulating between the cornea and the lens.
The word glaucoma is seen at the bottom of the screen. The screen reduces to only a circle surrounded by blackness to simulate vision in individuals with glaucoma.
Glaucoma may cause fluctuating vision, peripheral field loss, poor night vision, sensitivity to light, difficulty in reading or seeing large objects at close range, or decreased sensitivity to contrast.
The brown-haired toddler is seen again riding a push toy. The camera focuses on his face as he rides through a preschool classroom filled with other children and toys.
Glaucoma can cause eye pain or headaches, eye redness, hazy cornea, or a wide open pupil. It can also result in blindness.
A close-up of a boy's face is seen as he examines a pink feather. He appears to have had surgery for a cleft lip and palate. The boy holds the feather directly in front of his face as he uses both hands to explore the feather.
Coloboma is a failure of two layers of tissue to fully develop and close together. This may result in a notch or cleft in various parts of the eye.
The word coloboma is seen at the bottom of the screen. A large blurry splotch in the middle of the screen is used to simulate vision in individuals with coloboma.
A child with a coloboma has decreased visual acuity, increased sensitivity to light, and an abnormal inward or outward turning of the eye. Field loss can occur if the colobomas extend to the retina.
The child with coloboma is seen again as he holds a bundle of green yarn close to his face.
Cataracts and other depth perception problems may occur. Glaucoma may develop later in life.
A group of parents and their children with visual impairments are shown seated on the floor in a room lined with toys. A TV eye in the middle of the screen spreads her arms and stands up, wanting the parents and children to follow her lead.
There are other conditions possibly leading to visual impairment, such as retinitis pigmentosa, which can cause degeneration of the light-sensitive cells in the periphery of the retina.
A toddler boy wearing overalls, a red bandana around his neck, and glasses plays with colorful plastic shapes that link together. He is then seen walking outside in front of a giant papier-mâché turtle. The words retinitis pigmentosa are seen at the bottom of the screen.
The results may be decreased visual acuity, severe nearsightedness, possible retinal detachment, retinal scarring, visual field loss, and possible glaucoma. This condition often results in blindness later in life.
A toddler girl with glasses is seen lying in a hammock wearing warm clothing and a sunbonnet. The mother of the girl bounces her daughter in the hammock. The words cortical visual impairment are seen at the bottom of the screen.
Cortical visual impairment refers to damage occurring beyond the visual pathways, especially in the occipital lobe of the brain. The child's eyes may be healthy upon examination, but the problem exists in the brain's ability to translate visual signals into meaningful information. Spatial confusion is common.
A toddler girl with blonde hair and wearing glasses excitedly points to the camera at close range. The words retinopathy of prematurity are shown at the bottom of the screen.
Retinopathy of prematurity is a condition occurring in premature infants, which can result in retinal bleeding, scarring, and even detachment from the back of the eye. Damage can range from very minimal to complete blindness.